So we've talked about how it is difficult for you to diffuse into a large area. So your diffusion is about right here. Any bigger, you lose it. So we're going to work within that area. Otherwise, it's going to be difficult to pay attention to anything further. What we're going to do, we're going to give you a square. Can you see the whole square as one thing?
Yes.
Instead of looking at the lines?
Yes.
Okay. That is actually a little bit
Small?
It's a little bit, no, high. Can you diffuse that?
Yes.
Okay. You right-handed or left-handed?
I'm left-handed.
So we're going to put you on the left hand.
Okay.
What you're going to do is you're going to look at the square and not the marker or your hand.
Okay.
I want you to keep looking at the square and you're going to draw a circle. You're just going to keep going and going and going with those circles. Okay?
It doesn't matter what direction.
Nope. You go what direction you wish. You got that square? Look at the square. Keep going. Keep going. Still looking at the square?
Yes, but the thicker this line gets, the harder it is.
So keep that square. Okay, stop. All right. Now, when you erase that, we're going to do that again.
Okay.
All right, now we're just doing your left hand.
Okay.
So what you're doing is you're learning to get action while diffused. This time I want you to watch the marker and forget about the square. Do you feel more stable or less stable?
Less.
Yeah. Because you're zoned in, right?
Yeah.
And that's what you're used to doing.
Yeah. It's definitely a different
Now,
feeling.
we know that in the studies with myopia, it is lack of form, especially peripheral form deprivation. You're not leading with the form here and you're more unstable.
Yes.
Let's do your right hand.
Okay.
We're going to go back. Now that's not a perfect square, but go with it. Now your right
Yeah,
hand.
I'm feeling sweat. I'm getting nauseated.
Yeah, when you zoomed in or when you did zoom out.
I'm not sure.
See
Am I
the
zoning
square?
out? Yes.
See the square.
Okay.
And don't watch the. Is that better?
Yeah, it feels better.
Less sweat?
Yeah.
So it seems like that reaction is coming from the tendency and the desire to zoom in.
Yeah.
Now, the ultimate goal is to be able to eventually diffuse the whole board. But you can't get there yet because you lose your form recognition, peripheral integration, anything larger than that. So eventually, we're going to get you to a bigger square.
Okay.
Eventually, we'll do a bigger square. Left or right doesn't matter. I made it a little too high, didn't I?
That's okay.
Should be a little low for you. How does that feel?
Feels good.
Okay. Keep going, but watch your marker now. What happened there?
I'm starting to get nauseated.
Okay, back to the. Can you switch it back to the form? Can you get your square again? Did that calm it down? Give it time.
Yes.
It did, didn't it?
Yeah.
Yeah. Lead with the form, not with drawing. And so